In this presentation, we'll be looking at what you need to know about tuberculosis. This presentation was done by Miracle McCoy of the University of the Bahamas. Introduction. Tuberculosis is an infectious disease caused by a tiny germ, Mycobacterium tuberculosis, that enter your lungs when you breathe them in. It is called TB for short. TB germs are mostly commonly found in the lungs, but sometimes they can move to other parts of the body. When you have TB disease of the lungs, you can spread it to other people. There are two types, latent and active tuberculosis. TB has the ability to lie dormant in the body asymptomatic, not being able to be spread. TB becomes active when the immune system of the infected person is compromised. Once activated, TB can affect the lungs or other parts of the body. Mycobacterium tuberculosis is a bacteria associated with tuberculosis. Tuberculosis belongs to the high G+C gram-positive bacteria that forms a monophyletic group with the low G+C gram-positive bacteria. How are tuberculosis germs spread? TB germs are passed through the air when a person who is sick with tuberculosis disease coughs, sneezes, sings, or laughs. To become infected with tuberculosis, a person usually needs to share airspace with someone sick with TB disease. For example, living, working, or playing together. The amount of time, the environment, and how sick the person is all contribute to whether or not you will get infected. However, in most cases, the body is able to fight off the germs. How are TB germs not spread? They are not spread through quick, casual contact like passing someone on the street, by sharing utensils or food, by sharing cigarettes or drinking containers, by exchanging saliva or other bodily fluids, by shaking hands, or by using public telephones. Prevention. Tuberculosis spread can be prevented by wearing a face mask. Family members known to be infected at home, utensils should be kept separate and run if possible. Keep the most vulnerable kids or aged persons away from the infected persons. Avoid large gatherings. Wash your hands or sanitize regularly when outside the house. Avoid wearing wet or half-wet clothes. Keep the house sufficiently ventilated. Clean the AC ducts of the car and home regularly. And follow and educate on cough and sneeze etiquette. TB infection versus TB disease. There are a difference between those two. In TB infection, TB germs stay in your lungs, but they do not multiply or make you sick. You cannot pass TB germs to others. However, in TB disease, TB germs stay in your lungs or move to other parts of the body, multiply, and make you sick. You can pass the TB germs to other people. Tuberculosis signs and symptoms. Persons may experience a blood cough, fever, chest pain, chills, long-term cough, weight loss, fatigue, or night sweats. Treatment for TB infection. TB infection is treated with antibiotic medication, usually for 4 to 9 months. TB infection is not treated, it can turn into TB disease. It is important to take all your medicine, even though you may not feel sick. The most common medication used to treat tuberculosis include isoniazid, rifampin, ethambutol, and paranazamide. Here are a few of the listed drugs mentioned on the screen. Contact investigation. When a person is found to have TB disease, the health department looks for people who might have been exposed to the TB germs. The health department thinks that you might have been exposed to the TB germs. They will give you a TB test. TB test 1. Two types of tests can be used to see if a person has TB. A TB skin test and a TB blood test. A trained nurse will give you the TB tests. The TB test is simple and safe. The TB test is mandatory and will help us protect your health and the health of others. TB test 2. A negative test most likely means Negative test most likely means that you may not have been infected with TB germs. A second TB test might be required in 8 to 10 weeks to ensure you have not been infected with TB germs. A positive test means you have probably been infected with TB germs, but it does not necessarily mean you have TB disease. Other tests, like a chest X-ray, is done to see if you have TB disease. If the health departments find that you have TB infection, you will be offered treatment to keep you from getting TB disease. Treatment from TB infection is voluntary, but taking it will help protect your health. Your name and the results of your TB test will be kept confidential. This diagram shows the number of cases, deaths, and multi-drug resistant tuberculosis countries in 2015. Color-coded in light peach are from 40 to 99 per 100,000 population, and in dark colored 500 plus thousand. South America is an example of the country that is color-coded in light peach, and South Africa is an example of a country color-coded dark colored peach. Statistics. TB incidence is high in high burden countries. 30 high TB burden countries accounted for 86% of all estimated incidence cases worldwide. 8 of these countries accounted for 2/3 of the global total. These were India, 26%, China, 8.5%, Indonesia, 8.4%, the Philippines with 6%, Pakistan, 5.8%, Nigeria, 4.6%, Bangladesh, 3.6%, and South Africa, 3.3%. There is more about TB in India, TB in China, TB in Pakistan, and TB in Nigeria, and TB in South Africa. TB burden 2020. 2020, an estimated 99 million people fell ill with tuberculosis. Globally, the number of people newly diagnosed with tuberculosis and reported to national governments dropped from 7.1 million in 2019 to 5.8 million in 2020. Countries that contributed most to the global drop in 2019 and 2020 were India, 41%, Indonesia, 14%, Philippines with 12%, and China with 8%. Tuberculosis not only affects all countries, but also all age groups. Overall, in 2020, 56% of notifications were of reports of tuberculosis in adult males. 33% were adult women. 11% were children aged 0 to 14 years of age. And here are my references.